Welcome to Day 17 of our CPC Exam 2025 Prep Series with KS Medical Coding Academy. In today's session, we begin exploring the Radiology Section, Part 1, focusing on diagnostic imaging of the head, neck, and chest using Captain codes 70010 through 71139. Introduction to Radiology Section. The Radiology Section spans CPT codes 70010 through 79999 and includes diagnostic imaging, ultrasound, CT and MRI, and nuclear medicine. In this part, we'll cover diagnostic X-rays. These are some of the most commonly tested codes on the CPC exam. Radiology Section Format. Radiology codes are arranged by body region and detail the number of views, laterality, and whether contrast is used. For example, you'll see codes for 1 view, 2 views, or complete series. Phrases like limited or complete are important to differentiate during the exam. Diagnostic X-rays, head and neck. Captain codes 70010 through 70160 represent head and neck X-rays. 70010, complete skull series. 70110, facial bones, complete. 70150, sinuses. 70160, nasal bones. Always pay attention to the number of views and the specific region image. Diagnostic X-rays, chest. Chest X-ray codes have been revised in recent years to simplify them based on the number of views. 71045, 1 view. 71046, 2 views. 71047, 3 views. 71048, 4 or more views. Also, codes 71100 and 71101 are used for unilateral and bilateral rib imaging combined with chest X-rays. 2025 Guideline Updates. The 2025 CPT updates clarify the importance of documenting whether the same provider performed and interpreted the imaging. This helps determine whether you bill globally or with modifiers. Always check whether the provider only interpreted or also performed the technical portion. Book navigation tips. When reviewing your CPT book, highlight code ranges 70010 to 70160 for head and neck, and 71045 to 71101 for chest and ribs. Focus on differences like number of views and whether the service was unilateral or bilateral. Common CPC exam clues. Let's go over a few common CPC exam tricks. 3-view chest X-ray is coded as 71047. Frontal and lateral skull imaging falls under 70010. Right-sided rib pain with chest X-ray leads to 71100. These questions test your ability to decode clinical terms and match them to the correct CPT code. Real coding scenario tip. If a radiologist only interprets the image, use modifier 26 for the professional component. If the test is performed and interpreted together, no modifier is needed. This is a global service. If the technical part only was performed, such as using the machine but no interpretation, use modifier TC. Review key code groups. Here's a quick recap. Skull and head 70010, 70160. Chest 71045, 71048. Ribs and chest combo 71100, 71101. Use the index and the tabbing technique to find these fast in your CPT book. Understanding the number of views is often the key to getting these right. Quiz time. Let's test your knowledge with 5 CPC-style questions based on what we just covered. Pause the video if needed, and check your answers at the end. What's next? Coming up in Day 18, we'll dive into Radiology Part 2, Ultrasound, CT, MRI, and Interventional Radiology. These are essential for imaging-based CPC questions. Don't forget to like and subscribe for daily CPC exam prep content. Welcome to Day 18 of our CPC Exam 30-day series. Today we'll dive into Radiology, Part 2, covering ultrasound, CT, MRI, and interventional radiology. These imaging modalities are commonly tested in CPC exams, so let's break them down with coding tips and book navigation. Overview of radiology modalities. Radiology codes in CPT are organized by the type of imaging modality used. Today, we focus on ultrasound, which uses sound waves, CT scans, using X-ray imaging, MRI, using magnetic fields, and interventional radiology, which combines imaging with minor procedures. The Captain code range is 76,506 through 79,999. Ultrasound. Ultrasound codes fall between 76,506 and 76,999. They include diagnostic procedures, like abdominal or pelvic scans, obstetric ultrasound, like code 76801, guidance procedures, such as 76,942 for needle placement. Watch keywords like real-time, complete, and limited. These matter in code selection. Book navigation. Ultrasound. In your CPT book, the ultrasound section begins around 76,506. Use colored tabs to mark obstetric versus non-obstetric codes, vascular studies, and guidance codes like 76,942 and 76,937. Highlight any parenthetical notes about required primary codes. CT, computed tomography. CT codes typically range from 70,450 to 71,275. They are coded by body region, such as head, chest, abdomen, and use of contrast, without, with, or both. For example, 70,450 CT head without contrast, 71,260 CT chest with contrast. Book navigation. CT. CT sections are clearly labeled by region. Look closely at whether contrast is used or not. With and without contrast, codes often represent more complex imaging and may require clinical documentation. MRI, magnetic resonance imaging. MRI codes span areas like head, spine, and joints. They use no radiation, which is a major benefit. Examples include 70,551 MRI brain without contrast, 70,553 with and without contrast. Again, contrast makes a big difference in coding. MRI, navigation tips. Start at code 70336, and follow the MRI sections by body area. Color code your CPT tabs for head, neck, spine, and joints. Watch out for codes that include both pre- and post-contrast imaging. Interventional radiology overview. This is where imaging meets procedures. Examples include biopsies, drainages, and vascular access. Common guidance codes: 77,001 fluoroscopy, 77,012 CT guidance, 77,021 MRI guidance. These are often add-on codes and require a parent procedure. Interventional radiology navigation. These codes are usually placed at the end of each modality section. Watch for CPT rules that require pairing with a primary procedure, and be aware of NCCI edits that can affect billing. Recap table. Here's a quick recap. Ultrasound, real-time sound imaging, OB, guidance codes. CT, cross-sectional X-rays, pay attention to contrast. MRI, magnetic imaging, non-radiation. Interventional, imaging-guided procedures plus add-on codes. CPC tips. For CPC success, check contrast details in each imaging code. Use guidance codes only when documented. Be careful with add-on codes and pairing requirements. Always read parenthetical notes and code instructions. Quiz. Radiology Part 2. Test your CPC exam knowledge on ultrasound, CT, MRI and interventional radiology. Choose the best answer for each question. Up next, Day 19 Pathology and Laboratory Section. We'll explore CPT codes 800-4789398, including panels, drug testing, and molecular diagnostics. Don't miss it. Subscribe and turn on the bell to stay updated with daily CPC exam prep.